Hi, my name is Danielle Brazel, and I'm presenting a case of Nivolumab monotherapy in relapsed or refractory Hodgkin's lymphoma. Hodgkin lymphoma is diagnosed in 8,260 patients each year. It's a curable disease with 80% of patients achieving durable remission after first-line treatment, though the prognosis in relapsed or refractory classic Hodgkin lymphoma has a median overall survival of only 2 years. Despite the large amount of immune cells within the Hodgkin lymphoma tumor bed, the immune response is ineffective due to PD-1 inhibition by Reed-Sternberg cells. Preclinical studies and early phase trials show strong rationale for targeting PD-1 blockade in classic Hodgkin lymphoma. Currently, PD-1 targeted agents Nivolumab and pembrolizumab are approved for relapsed or refractory classic Hodgkin lymphoma after stem cell transplant and brentuximab failure. We present the case of heavily pretreated classic Hodgkin lymphoma with 3 episodes of recurrence that was ultimately successfully treated with nivolumab. Our patient is a 39-year-old female who presented in April 2014 with flu-like symptoms, night sweats, and weight loss. Biopsy confirmed stage 2A Hodgkin lymphoma, and she achieved complete remission after 6 cycles of ABVD. Her disease recurred in February 2015, and she had a near complete response after 2 cycles of brentuximab. She underwent stem cell transplant in June 2015. When she relapsed in 2016, she felt discouraged and opted for holistic therapy. Her disease continued to progress with extensive lymph node involvement both above and below the diaphragm, as well as bone and splenic metastases seen on a March 2017 PET-CT scan. She transferred care to our institution July 2020. At that time, she had severe weakness, cachexia, dyspnea, night sweats, and fevers. She started treatment with nivolumab August 2020, and her PET scan 2 months after initiation showed favorable response with both fewer and smaller lymph nodes. At 1-year follow-up, her tumor burden continues to decrease on monotherapy. The prognosis in relapsed or refractory classic Hodgkin lymphoma is just over 2 years. Through genetic alterations at chromosome 9p24.1 activating the JAK-STAT pathway, or through incorporation of the Epstein-Barr virus genome, classic Hodgkin lymphoma Reed-Sternberg cells upregulate PD-L1 and PD-L2. This upregulation of both checkpoint ligands suppresses PD-1 intratumoral T cell function, and the T cells no longer perform surveillance on the tumor cells. Nivolumab is a fully human monoclonal IgG4 antibody against the PD-1 receptor. A phase 1 study demonstrated objective response rate of 87% in heavily pretreated patients with relapsed or refractory classic Hodgkin lymphoma. A phase 2 trial of nivolumab in relapsed or refractory classic Hodgkin lymphoma showed that overall survival at 1-year follow-up was 91% with tolerable safety effects. The response rate was 65% with 8.7-month median duration of response. The most common adverse events were fatigue, infusion-related reactions, and rash. These results led to FDA approval of nivolumab in classic Hodgkin lymphoma in May 2016. Extended follow-up of the CheckMate 205 trial of nivolumab in relapsed or refractory classic Hodgkin lymphoma found an objective response rate of 69% with median duration of response 16.6 months. The median progression-free survival was 14.7 months. The most common severe adverse events were elevated lipase at 5%, neutropenia in 3%, and elevated liver enzymes in 3%. Similar promising results of PD-1 blockade were also shown in the phase 2 KEYNOTE-087 studies of pembrolizumab with a response rate of 69%. Given the promising response rates and tolerable safety profile as seen in our patient and the existing literature, more research is needed on the role of nivolumab in the first-line setting of classic Hodgkin lymphoma. This study also shows the benefit of supporting our patient's autonomy and keeping an open dialogue while trialing holistic medicine, because ultimately our patient came back to chemotherapy, immunotherapy, and was able to successfully treat her disease. Thank you for your time.